Okay, we're live.
We're live. So good evening, and I'll call the meeting to order of the Finance and Property Committee. First of all, before we proceed, I'd like to take a moment to acknowledge that the Health Unit resides on land covered by the Robinson-Huron Treaty of 1850, and that we're all treaty people. This land is the traditional territory of the Anishinaabe people, and is also part of the unceded territory of the Algonquin Nation. I'd also like to acknowledge that the Métis historical presence in the region. I encourage everyone to learn more about how they may contribute to the process of reconciliation. So the first order of business is the 2.1, election of the chairperson. And then we'll go on to the election of the vice chair of the Finance and Property Committee. So we've got three nominees for the chairperson: Sarah Inch, Marianne Stickland, and David Wolf, and they have allowed their names to stand. And so thank you for agreeing to do so. Appreciate it. At this time, I'll also ask if there are any further nominations, if anybody wishes to nominate anybody. So hearing none, we'll proceed. And since this is a new board and you don't all know each other, I'd just like to begin by asking each of the nominees in turn to introduce themselves and say a few words about why they would like to be head of this committee. So in no particular order, I'll ask Sarah, and then Marianne, and then Dave. So Sarah, if you could you just put your mic just a little closer?
Sure. Yeah.
It would be an honor to be
I think we have to
chairperson. I need to turn something off, apparently.
Yeah, just the
there we go.
Sound.
Yeah.
Thank you.
You know, I don't have any experience on this board, so I would be a fresh set of eyes and ears. And, you know, I'm currently sitting on City Council as Vice Chair of the General Governance Board and learning about the budget process as I go and getting a lot of information from various community sources. I would apply anything I learned there to this role. However, I'm also in favor of having someone else take this role. So, yeah, thank you.
Thank you, Sarah. Marianne?
I'm Marianne Stickland. I'm a councillor in Strong Township in the southeast portion of the Parry Sound District in Sunny Sundridge. And I was on the board the last term. Enjoyed my time. My background is administrative and financial, and the same as Sarah had mentioned, if someone else wants to do it, that I'm totally fine with that as well. It's just, sometimes people don't step up to the plate. So for all the newbies, you know, I was just going to put myself out there for that. So thank you.
Thank you, Marianne. David?
A bit shocked that my name was actually there. I did when speaking with Sherry, I did indicate that I was happy to step up if there were a lack of individuals willing to do so. I actually feel that in these particular cases with new people on the board, if there are returning members to the board who have some experience and can offer a greater amount of insight, it might be better to have that. I'm happy to step aside actually and nominate Marianne, who has indicated previous to me that she has board experience and is a returning member. So I don't want to prolong the process, but if Sarah is also inclined to second that motion, we can dispense with the voting procedure if that's the case.
Yes, that sounds good to me. Thank you.
Oh, well, you know, I do want to say that we really think it's great that everybody showed so much interest and engagement, and certainly appreciate where you're coming from. But that's fantastic that we can, that you all step forward and wanting to make this, because this year is certainly going to be a year of some very important financial decisions that are going to have to be made. So we really appreciate you all being so engaged. So given that, if as you've said, then let me put it this way: as far as the voting goes, is anybody objecting to Marianne being the chairperson?
I think Dave passed a motion already.
Pardon?
I think Dave passed a motion already, didn't he?
Yeah.
Yeah. So all in favor? We can. It seems that everybody would be in favor. We could dispense with the poll unless you want to try it, just to see how it goes. Do you have it all set, Sherry?
Oh, I can still launch it if you want.
Yeah, why don't you try and launch it, just so that it's the first time we're using it, so we want to make sure we do it right.
So we'll try this. Okay, here goes.
Okay, here goes.
Oh, perfect.
Did it pop up for everyone?
Yep, it's popped up.
Awesome.
So Sherry, it's Dave Wolf. I have voted. Do you see that, or who has voted?
No.
Okay, so you'll just get a tally of the number of votes?
Yeah.
So mine popped
Okay.
up, but there's no names beside anything. There's 3 dots, but no names.
Oh, okay.
Mine as well has 3 dots and no name.
Isn't that weird?
I'm glad we're trying this.
I got the 3 names.
Yeah, I did get the name.
I got 7 responses now.
So do I. I see 7 responses as well.
Okay. Anyway, I just, it's just 3 dots of the other.
So what you might have to do
If you use the back arrow,
is, oh goodness,
now we're in daily weather.
go into the little app.
There should be an app button on the top.
Okay, I see it down there because there was a thing came across the top
So
and I pressed on that, but I see it there now. Okay. It was in the chat box.
Where
There.
There's the poll. You hit hit submit, and then the arrow right here to go back, and you're back to your page.
I just have the 3 dots as well. I don't quite understand where I'm getting the names.
I had to go down on the iPad on the very left-hand side. There's like a little chat bubble, and I clicked on that, and that came up with the 3 names.
Yes, if you click chat. So far we have 10 responses.
Click chat? Sorry, I don't understand.
Right at the top.
Go into the apps, is that correct?
No,
Or you can go that way.
or just above the images.
Just above the images.
Like the people's
sorry.
pictures on screen?
He's on an iPad.
Yeah.
You're on an iPad, Gary?
No, I'm on the
Teams.
Teams, but the device you gave me.
Okay. Okay, so at the
At the top,
bottom,
I can. At the bottom, okay.
at the bottom of the screen, there's a little chat bubble with a red dot. Do you see that?
On the left end, is that correct?
Yes. If you check that, if you press on that,
Yes,
it should.
it does come up.
It should show
I'm
you
sorry,
on
I
the
was
side.
pressing. Yeah, okay. And submit. Okay.
There,
Good. Well done.
11 responses.
And what would be the result?
It was 100% for Mary Ann.
Okay. Thank you so much, Mary Ann.
Dr. Chairco,
So
were there
that-
others nominated but declined?
Yeah, 2 others
Okay.
were nominated
Yep.
and they declined.
Yep, no, that's fine, yeah. Understood.
All right. So that was moved by
We'll put moved by Dave
Dave,
and seconded by Sarah.
seconded by Sarah. And so be it resolved that Mary Ann Stickland be elected chairperson of the Finance and Property Committee for the North Bay Pearson District Health Unit for the year 2023. And we've got it all recorded. So now I'll turn it over to Mary Ann to go through the agenda. And the first order of business would be 2.2, election of the vice chairperson. So I'll turn it over to you, Mary Ann.
Okay, just a second. I have to get up to the top here. Just a second. Okay, so do I have any information on who the folks are that are going to be running?
Yep.
Okay.
We'll give you that.
Okay, so we have one nomination for Jamie Restool for Vice Chair of Finance and Property Committee.
Okay, so Jamie, you are going to let your name stand?
Yes.
So then we declare Jamie the vice chairperson of the property or the Finance and Property Committee. I don't think there's a vote, right? It's
Are there any other nominations?
okay.
I nominate Councillor Jamie Lowry for vice chair.
Okay, any further nominations? So we'll follow the same process then if both of you, starting with Jamie, if you could just tell us why you would want to be on the vice chair of this committee.
Which Jamie?
Which Jamie?
This is going to be fun.
Yes. Who was the first one that was nominated? It was Jamie
Jamie Restool.
Restool. Yes. How about we'll start with Jamie Restool.
Okay. New to the board here. I bring about 11 years municipal councillor experience. I'm also the chair of the West Nipissing General Hospital, and I sit on DSAB as well. So a lot of experience in the board environment. I'm content with any decision the group here makes. It's good to see that there's another name up on the board as well. So may the best Jamie win.
Thank you, Jamie Restool. Now, Jamie Lowry.
I'm Jamie Lowry. I'm new to council. I was the CEO of Castle Home for a number of years. Before that, I was a commissioner of community services in Brampton for almost 10 years, and so used to running large organizations. Very familiar with the governance model. So happy to be nominated. So again, same as Jamie. Whatever the group decides, I'm fine.
Okay. So we proceed to our vote. Same process as before. Right.
waiting for 2 more responses.
Mine didn't pop
Oh,
up.
mine didn't pop up.
Yeah, mine didn't
Sorry.
pop up either.
Go to
Can you go to your chat?
Yep.
Mm-hmm.
Oh, got it. Thank you. Sorry, it's just waiting for it to
That's
pop
okay.
up.
Okay, so we have 55% for Jamie Lowry and 45% for Jamie Restool. So the motion is for Jamie Lowry.
So congratulations, Jamie Lowry. You are therefore the vice chairperson of the Property and Finance Committee for the next term. So,
Thank you.
so then we move to the top for the approval of the agenda, or
First, Marianne, can I get somebody to move and second the motion?
okay. So we're looking for a mover first, and
I
that
can
would
move
be
Sarah? And a seconder? Rick?
Jamie
Thank you.
Bristol, I'll second that.
Oh, okay, thank you. And vote, well, it's all in favor?
They already voted.
Yes.
So.
All in favor of the motion?
Yes.
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 Thank
Yes.
you. Okay. Now we can move on to the approval of the agenda.
Okay, so I'm trying to look at everybody here and get familiar with faces. So we've called the meeting to order. I'm looking for someone a mover for the adoption of the agenda.
Sure, I'll move it.
Jamie,
Yep.
or I can't even see here. Jamie McGarvey was first, and
Okay.
Jamie Restool, were you second?
Okay,
Okay.
Yeah, that's fine.
So be it resolved that, or did anyone have any additions to the agenda or any changes they would like to make? Okay, hearing none. Be it resolved that the Finance and Property Committee agenda dated January the 25th, 23 be approved as circulated. And we'll have to have a recorded vote. And we'll go Karen Cook,
Yes.
Sarah Inch,
Yes.
Jamie Lowry,
Yes.
Morris Schweitzer,
Yes.
Dave Wolf,
Yes.
Rick Champagne,
Yes.
Jamie Restool,
Yes.
Blair Flowers, Blair Flowers,
Yes. Your mic.
myself, yes, Jamie McGarvey,
Yes.
and Gary Gunther.
Yes.
Okay, so that motion is carried. Moving on to number 4, the conflict of interest declaration. Does anyone have a conflict of interest to declare at this time? No, hearing none. Let's move to 5.0, the approval of the previous minutes. The 5.1 is the Finance and Property Committee minutes from September the 28th, 2022. So we're looking for someone to move the motion.
Dave Wolf, I'll move that.
Doesn't
Dave,
have to be.
pardon me?
We're just clarifying that we've had legal opinion in the past that you don't have to have been present at that meeting to either to move or second or to approve.
Okay, so did I hear Dave Wolf move it?
That's correct.
Okay, and I need a seconder.
I'll second it, Marianne. It's Gary.
Gary Gunther will second it. So be it resolved that the minutes from the Finance and Property Committee held on September the 28th be approved as presented. And we'll have to go for a recorded vote. Karen Cook,
Yes.
Sarah Inch,
Yes.
Jamie Lowry,
Yes.
Morris Schweitzer.
It's Switzer, thanks.
Okay, thank you for, yes, thank you for that. Dave Wolf?
Thanks.
Yes.
No, I'm abstaining because I wasn't at the meeting regardless of the legal opinion. I don't feel comfortable.
And who's that, Morris?
Yes.
You're abstaining? Okay, noted.
Yes.
Thank you. Rick Champagne,
Providing it's legal, yes.
Jamie Restool,
All right, yes.
Blair Flowers,
Yes.
myself, yes. Jamie McGarvey
Yes.
and Gary Gunther.
Yes.
Okay, that motion is carried. So moving on to 5.2, the property or the Finance and Property Committee in camera minutes from the meeting on September the 28th. So the notice of motion is be it resolved that the in-camera minutes from the Finance and Property Committee held on September the 28th be approved as presented. So we'll do another recorded vote. Karen Cook,
Yes.
Sorry, point of order. Do we have a mover and a seconder?
oh, shoot, yes. Could I please have a mover and a seconder for the in-camera minutes of September the 28th? I'm looking for a mover.
I'll move that. It's Jamie McGarvey.
Jamie McGarvey, okay, and a seconder?
I'll second
Karen
it, Marianne.
Cook.
It's Gary.
Okay, I'll take Karen Cook. I heard her louder, Gary. Sorry. As a second, and I will reread the motion. It is, be it resolved that the in-camera minutes from the Finance and Property Committee held on September the 28th, 22 be approved as presented. So we will start the recorded vote again. Karen Cook,
Yes.
Sarah Inch,
Yes.
Jamie Lowry,
Yes.
Morris Schweitzer,
I'm
Switzer.
going to abstain again,
Okay.
Marianne,
Yeah.
because I wasn't here. Regardless of the legal opinion, I'm just
Yeah,
going to
no,
abstain.
that's fine. Noted. And Dave Wolf,
Yes.
Rick Champagne,
Yes.
Jamie Restool,
Yes.
Blair Flowers,
Yes.
Marianne Stickland, yes. Jamie McGarvey,
Yes.
and Gary Gunther.
Yes. Is that loud enough?
Yes, thank you. That motion is carried. Okay, so moving on to the date of next meeting, the time, date, and location will be determined. Business arising, I don't believe that there is any that carried forward at this time. Does anyone differ with that opinion? Okay, well, hearing none, so we'll move on to new business. 8.1, the operational plan and financial budget proposal for 2023. And I think that Isabel is available to guide us through some of the process.
Yeah, Dr.
Yeah.
Cherko is going to start.
Okay,
So
Dr.
thank you
Jericho,
very-
take it away.
Okay, thank you, Marianne. Appreciate it. And so for many of you, this will be your first exposure to the health unit's operational plan and financial budget. The principles this budget is based on, in my opinion, is reflective of the health unit's values of honesty, transparency, accountability, collaboration, and excellence, and compassion. And we hope it's provided you with the information that you require to make an informed decision. We welcome any and all questions. The executive team is present virtually to answer questions as best we can. And if we don't have the answers readily available, we'll be sure to follow up with you. Public health persists with dedication to accomplish regular work in the face of pandemic recovery priorities and other increasing responsibilities. Marginal funding increases in the last 7 years, paired with the effects of the provincial inflation rates, have impacted the ability of public health, including our health unit, to achieve mandatory program goals and objectives within a balanced budget. The health unit's 2023 operational plan and budget proposal identifies an urgent need for more public health funding. This has been communicated to the Ministry of Health. Improved, sustainable funding is imperative to meet the ever-increasing demands placed on public health. In 2023, it is predicted that there will continue to be a funding shortfall for public health units. To plan and prepare accordingly, in the fall of last year's managers were asked and tasked by the executive team with reducing their program service budgets for 2023 by 2%, and these were non-salary costs. With 80% of our health unit budgets being salaries and benefits, and factoring in our negotiated settlements for both unions and management non-union contracts, unfortunately, savings from reducing program service budgets was not enough. To offset the predicted shortfall, the executive team, working with management, identified additional areas for cost savings, which included reductions in salary costs, permanent positions for 2023. Furthermore, the executive team also determined a need to realign staffing capacity to support the organization in effectively addressing COVID-19 recovery priorities and emerging trends. The realignment in capacity resulted in the addition of some new positions while still maintaining an overall reduction in permanent budget dollars. So I'll now ask Isabel Churcher to provide you with a more detailed explanation of the operational plan and budget proposal. And please feel free to ask any questions at any time.
Good evening, everyone. I'm just going to talk very shortly about a few key things. Dr. Cherico mentioned the negotiated settlements. We also have some significant increases in benefit costs that are expressed on page 36 of the document. Also, inflation, like at your house and mine, plays a role here. So we've had increased audit fees, insurance, utilities, and transportation, similar to you do at home in your budgets, I'm sure. We have, in the last couple of years, taken certain costs out of the budget, and we're trying to fund them with unexpended dollars from certain unfilled positions. So those things would be things like maternity leave top-ups, and in the case of this year, some of our costs for moving the Parry Sound office to a new facility, which is in the planning stage, it will have to come out of those kind of dollars and are not shown in this budget. Ministry funding is for this year has not been expressed to us. Any indication of what the percentage will be from the province is not yet known. The Ministry of Health still does not know their own budget yet. The annual service plan process, which is a process where we take the numbers out of the document that the Board of Health has approved and submit them to the province. We have not received that document yet, and normally at that time that we do receive it, we receive maybe some indication of what the funding might be. And we also receive a list of eligible one-time funding pockets. We have not done that yet. We have not received that yet. But in the same token, we have been told that COVID-19 extraordinary costs will be covered for the 2023 year. We are currently working on a one-time funding request or budget for those COVID dollars, which will likely come back to a February meeting for you to approve at that time. The last topic I'm going to talk about is the levy, the municipal levy. You will notice in the document, especially in Appendix 5 on page 42, there is a table that shows the changes in the percentage per municipality. And you'll notice that there's no individual population shown on any of the tables this year. There's been a change with MPAC, the Municipal Property Assessment Corporation, and they would not give me permission to share individual municipalities' populations to other municipalities. So I was told the information is no longer public information. So when we do send the levy out, you will see individually as municipalities, they will see their own population on their levy statement at that time. And that's the end of my comments. I'm happy to start taking questions, and I'll defer them to whoever I think can answer them best.
Jamie McGarvey.
Jamie McGarvey?
Yeah, I was just going to make a comment that given everything that's gone on over the last 3 years and the unknown that was going to be for 2023 and that sort of thing, I think you've done really well to try and pull this together so that it's a workable budget, that it's going to be. I can't see municipalities really complaining a whole lot about it, given what you presented. Well done. I mean, really well done. Thank you to the team for doing this and putting it together. Given what I'm hearing out there from other areas and that sort of thing, thank you.
Thank you so much, Jamie.
And just to give a little bit of context to what Jamie just mentioned, we last year rallied or whatever you want to call it, sent resolutions around for other municipalities to sign, because what was kind of heading our way was a 43% increase. So when I got my package, I could have given Isabel a great big hug, because that was not what I was expecting. And I probably wouldn't have let my name stand for the committee because that would have been untenable. So thank you. It was a pleasant surprise.
Jamie Lowry has a question here in the room.
Yeah, I just have a question on these are great budget numbers. I like the presentation of it. Not because it's a reduction in some ways, but one thing I'm curious about is, the health unit helps a lot of people. And do we keep metrics on how many people we've served and the things so there's really, putting a face or some sort of value, I guess, in some ways to some of these programs. I know there's a lot of great things that happen with the health unit and the staff and the outreach. And if there was some way to start to categorize or start to capture and really put a face on the value of the health unit. I mean, people understand it, but it would be great if we could have some of those things.
We do.
Oh, okay.
And it's the annual report.
Okay.
But because of a lot of the issues that we've had in redeployment and dealing with COVID, that was something that we will get to it. But there are previous ones from different years that you might be able to have a look at to show and identify all the services and what we've done. So that's a really good point, and absolutely.
It's just that, for trend purposes, if you're looking at a budget, it's nice to be able to see, well, why are you applying some more money to this and taking away? Like, I was a little bit nervous about the public health nurse, about the reduction there, because I think that's an important issue to maintain some really, quite honestly, to some resources there. I mean, there's a reduction, but I think that's something that we should keep an eye on, because it's a little bit nervous about that one. be honest with you.
we'll be able to sort of explain
Okay.
that, in that there will be sort of opportunities for that. It's a position that we're looking at. So.
Okay, and there are documents, I'll just reply to your question too. There are some documents that are filed with the province on a regular basis. So at some point, we might be able to bring some of that data. Like right now on the fourth quarter report, we're reporting statistics on a lot of things, like how many pools were tested and how many beaches were done and all those kinds of things. So there's a possibility of bringing some of that forward at some point.
And, you know, comparatively to other health units, I suppose would give you sort of a...
Yeah, we don't.
I mean,
we don't get access to anybody else's information but your own. Usually, that's not. We do when the other health units supply annual reports. Those do get put into your package and under correspondence, so you would see them at that time when we get them. So that might help you along with that. I'm going to get to you next, Morris. I have David Wolf ahead of you. David?
Hi, thanks very much. Chair, through you, just a couple of quick questions, and I'm not familiar with your process, so you'll forgive me and extend a little latitude, I hope. Table 3, which extends over several pages, as you know, under many of those categories, we see other expenditures. I'm just curious if you can shed a little light on what some other expenditures might mean.
Okay. We're using the format that the province uses here, just so you know why we've done it this way.
Okay, thank
other
you.
expenditures includes everything from pretty much everything that's not in the previous 3 categories. So purchase services would be in there, and purchase of materials, all the clinic supplies, utilities, everything else pretty much is in that other number.
So in some of...
It's not salary, yeah. There's the professional services that you see is purchase services of like dentists and all those type of lawyers, all those ends up in professional services.
Right. So I understand those are likely third-party contractors in some way, external to the organization. But in other expenditures, I see in some of those columns, the increase is not, insubstantial. There's decreases in some other areas. But as a board member, I have no way of knowing what those, when we're talking about looking at having to find some dollars, perhaps. I just wonder if more information is available around those numbers. But thank you for the explanation, because I think that is helpful to know that it's the provincial format that you're using. So if we have specific questions around some of those areas, Dr. Chirico, can we get access to that information, a more detailed outline to some extent? I'm more comfortable knowing what the overall picture looks like, as opposed to just, the compartments of it.
Yeah, there is that opportunity. We certainly have worked very hard over the years to be as transparent as we possibly can. Nothing is certainly being hidden at all. So yes, if you had specific areas that you were concerned about seeing, like let's say if there was a discrepancy from one year to the next and you had questions about it, yeah, we'd be happy to provide you with that information.
Okay, I figured as much. Sorry, Isabel.
Yeah, there's lots of also information, like the occupancy cost is in table 9. A good portion of that is part of that other expenditure number. So.
Okay, so there's some crossover between where I'm seeing one and where I'm seeing the other. That's good. So the other question I have in
details.
Yeah. So the other question I have, and it's not clear to me, and maybe it is outlined somewhere here in the notes. Is the health unit currently sitting on any surplus? Do we levy for a surplus? How does that work, and where is that reflected in the document if that's the case?
So we are not allowed to keep any provincial money. So any unspent provincial money all goes back. So the only reserve that we have is the municipal reserve. And on Appendix 5, where the municipal levy is at the bottom of that table, you'll see the municipal reserve balance at the end of November was at 1.8 million.
Okay, sorry, I missed that when I was going through. Yes, I see it there now. Thank you very much. And then a couple of other very quick things, if I may. On page 26, Healthy Smiles Ontario, under wages and salary, we see notes and it says number 3. And I'm not sure that that reference is, when I look at the notes in table 4 for the notes, the note number 3 is for emergency management salaries and wages budget 2023.
I think that's a typo, because
Okay.
the notes are normally numerical order.
I figured as much, so I thought I would point that out. And then as I'm looking at, and this is the last thing I have for the benefit of my fellow trustees who are probably waiting for me to conclude. Appendix 2, under the table summaries, summary of by position, I see a lot of numbers, and I look through the numbers, and I'm not qualified to say whether those are reasonable or unreasonable amounts and so forth. But I'm wondering if when we see those, if there's some way of distributing that so that we can see the percentage increases or decreases, so it's really clear we know where we're going with those.
So I feel we have done that, but maybe you just don't know the connection between the documents. This table lists all the permanent positions of the health unit, so none of the temporary ones. And the year-to-year difference, so the difference on page 34 at the bottom, the difference between the 2 years is explained in 2 tables further on, number 8. The total changes in table 8 are the difference between those 2 numbers. Does that make sense to you?
Yeah, I see that now. I guess a note on pages 30, and that's I didn't draw the connection between the 2. So thank you for taking me there. I appreciate it. That's all I have, Chair.
I just want to make a comment that please, we're really glad that you are asking those kind of questions, Dave, and that we'll take all the time that you want, because it takes quite a while to get sort of familiarized with all of the information. And I was slower than most people. It took me a few years to get it under my belt to understand it. So thank you for those questions, and don't feel that you're taking up our time, and don't feel that any question is too simple to ask. So please ask whatever you'd like.
Thank you. I appreciate that.
Morris, it's your turn.
Yeah, thanks. And through the chair, I was glad that that Jamie Lowry raised that issue about numbers, other than numbers of people serviced by the health unit, other than numbers in the budget. Is the budget as provided to the ministry? Is it follow just a strict template? Are there any opportunities to talk about the numbers of people served? Because I noticed in Dr. Chirico's report, there are lots of numbers in there.
So there's many reports to the ministry that go in a year, but the annual service plan has a very extensive planning section. So every public health standard has outlined all the activities that are planned for the year and the expectations we have in getting to those plans. And then when we do an annual report, we report on whether we achieve those things or not. So that's the kind of process that goes through the ministry. We send in plans, then we report on plans at the end of the year, sort of thing. And then each quarter we send in financial data, but also at least twice a year we're sending in reports of those kinds of statistics on how many of these and that we've done. And then narrative reports on, say, what the school program might be, or all those kinds of things. The reporting back to the ministry is quite extensive, actually.
Mm-hmm. And the reason I ask is that any provincial agency that I've been involved with, we made sure that we didn't just provide at our budget time just the dollars we were looking for. We felt obliged to and thought that it helped our case to do some cover some of the numbers of the people that benefited from our organization. So it's a thought, and I agree with Jamie Lowry. Yeah, thanks.
Sarah?
Yeah, so I'm wondering about the benefits. They've gone up quite a bit. Have you considered going to market for those, or how are you sourcing?
Yeah, so right now, we didn't have the capacity to do that right away, but the people that we are dealing with tend to do some of the broker is doing this kind of looking for the best rate on an annual basis. It is something that could be considered when we're a little bit more out of the pandemic and have some capacity to do that. With the negotiation year, there was no capacity in-house to facilitate that. I don't know, Jose, did you want to speak any more to that topic?
Oh, yeah, I'm on the screen now. Yeah, so in 2016, we actually did make significant changes to our benefit carrier and benefit consultant, and we saved probably about 200 to 250,000 by making that change. But certainly it wouldn't be. It could be something that we can definitely look at, because benefit costs are definitely increasing, and now that we're past dealing with the pandemic, there would be more time to allocate to that.
Can I ask who you use for the benefit carrier?
Yes, so the benefit carriers for health and dental is ClaimSecure, and then AIG for the dependent life insurance, long-term disability, and then our benefit consultants are Debrina, and so they're the ones that we work with to also negotiate with all the carriers.
And we are on for health and dental. We're actually paying just administration fees, because we're actually paying the cost that the person incurred. We're not paying insurance premiums. We're just paying cost plus admin fees for those.
Okay.
Any further questions from anyone at this time? No? Isabel and Jose, thank you for answering the questions. Were there any questions that were submitted by our board members to have answered before we take a vote?
There was only one question, and I can sort of explain the question, I guess. Oh, here, somebody's handed me the question, so that's good. So the question was the difference between the total expenses on page 16 and the total expenses in the
31.
chart. Yeah, on page 31. And so the answer is that 31 has the revenue taken out of the number. So if you go to the net expense line on the summary, it's out by $100,000 from the number at the back, and that number is Stay on Your Feet funding, which is actually in the next line underneath. So the 100% funded line contains the 100,000, and if you take that off, you get to the two numbers then agree. And that was the only question we received.
Thank you, Isabel. So there are no more questions. Oh, someone has their hand up. Go ahead. I just see a hand. I don't see who it is.
I think that's Sarah's hand from before. Are you done?
Yeah, that was
Is
likely
it?
my hand from.
Yeah.
Okay. So no more questions at this time? So everybody's prepared for the big vote? Let me read the motion first. Be it resolved that the Finance and Property Committee recommends that the Board of Health for the North Bay Parry Sound District Health Unit approve the 2023 Board of Health Public Health Budget as presented with a total shareable base of $17,160,804. So I am at this point in time looking for a mover, but just a second, I've got to get you back. You're gone, everybody's gone. Just a second. Okay. So I'm looking for a mover for the big motion. Okay, Jamie McGarvey for a mover and a seconder.
I'm fine with it, Mary
Other
Ann.
Jamie.
Jamie Lowry here.
Gary Gunther was the one that seconded. Okay, so now we're going to go for a recorded vote to approve or to recommend the budget to our board. So Karen Cook,
Yes.
Sarah Inch,
Yes.
Jamie Lowry,
Yes.
Morris Schweitzer,
I don't know who he is, but I'm Morris Switzer, and he says yes.
Switzer, Morris Switzer. My apologies. Thank you for voting. Dave Wolf.
Just one of those votes.
Yes. Dave Wolf.
I vote yes.
Rick Champagne,
Yes.
Jamie Restuel,
Yes.
Blair Flowers,
Yes.
Mary Ann Stickland, yes. Jamie McGarvey,
Yes.
Gary Gunther.
Yes.
The motion is carried. So then we move on to the next item here. What is our next item? Is the informational 8.2, the annual report and attestation for 2021. I see that Isabel had prepared the note. I'm not sure if Isabel or Dr. Chirico want to comment on it.
I'll start. This is part of the annual report that it seems rather late now, but the ministry was behind with their reporting template. So this, the full annual report is about, 30 pages long or something. But we thought it was important that you see this attestation form that it's necessary for us to fill out on an annual basis. And as I said in the briefing note, the last time it was done pre-COVID, we actually were able to answer yes to all these questions, but for the year 2021, where we were heavily into the pandemic, we were not able to. So you see some of the explanations here of why the executive team got together and filled in this report together, and we have explanations of why and what parts of the standard we were unable to achieve. It's for your information, and certainly we'll answer any questions you might have about it.
Yeah, I'd just like to comment that what this allows us to do is we want to be transparent with you. You are responsible as a board for achieving the Ontario Public Health Standards. And so we're being very transparent to say what we can do and what we've accomplished. And as Isabel indicated, in prior years before the pandemic, the answers to these questions were all yes, we met the standards. Increasingly, it has certainly come to light because of the pandemic that with the scarce resources that public health has, we had to redeploy our staff, as many others had to do in different sectors. And so we couldn't do business as usual. My caution, or as far as when we move ahead, it needs to be kept in mind. And one thing that we have indicated to the ministry, and we're not alone in this, many health units are in the same position because of what we feel is a lack of funding to public health and what we're being expected to accomplish with all the other emerging issues that we have to deal with, that it's going to be increasingly difficult to meet the Ontario public health standards without sustained and improved funding to public health year after year. So we will be more than transparent and with future sort of reports like this to be able to show you exactly what we are able to accomplish and what we haven't been able to accomplish.
Thank you, Dr. Chirico. Does anyone have any questions on the report, the attestation at this point?
Madam Chair, it's Dave Wolf. Just one quick one for Dr. Chirico.
Yes.
Notwithstanding the fact that we've had COVID, pre-COVID, you indicated that you were able to answer yes to all the questions, which is, I would hope, yes. And that moving forward, I'm going to assume we hope that we're going to be able to answer yes to all the questions, but we don't know, if I understood you correctly, because we don't know what the funding model may or may not look like. So there's some assumptions that we're making. If you were unable to answer yes to all the questions, what happens?
So if we don't answer yes, and we submit this to the ministry, first of all, to the board, we would be accountable. And I would be accountable to the board to explain sort of why we weren't able to meet it. The other thing is that we send it into the ministry, and we are accountable certainly to the ministry as well. And depending on what we've answered no to, they may or may not give us a call or talk to us about sort of what's the issue. So we do have relationships with the ministry. We do communicate constantly. And so they may understand certainly why it's beyond our control. And so we would have that conversation about it. And depending on what the issue is, how far off we might be, and what they believe to be our explanation, they might want further information or accept it as is, or offer some suggestions on how this may need to be corrected. So I'll pass it to Isabel if there's anything you'd like to add to that.
No, I think and this report is, it seems to me it's like it's in its early days, because this is only the second time, even though the first one was in 2019, in between we didn't do it. So this is only the second time it's been sent in. So I think it's a bit early on in their process. They did start a whole new accountability process in 2019 that we've done some of, but not all of, and we're trying to get back to it again in its full capacity. So I think it's still perhaps early days to see what they actually do and what response we get back, say, to this document. Right now, I think it may be a different response because most of the issue is COVID than it would be later when COVID may be not an issue any longer.
So answering no is not tied to dollars?
Not right now, no.
Okay. My concern was that if we are not meeting certain standards, that it might be reflected in the transfer of payments from the province to the organization. But that's great. Thank you very much.
No, that's an excellent point that you make, David, and appreciate that. And the other thing that turning it around, it could be a very good rationale for increasing funding as well.
Yes, Jamie.
Yeah, that's actually your last point that you made, Dr. Chirico, was what I was going to say. Was those no's, when you look at them, are good points for advocacy for more money for public health. And I think that's where we can take this and try to capitalize on that and formulate that into advocacy, because I'm sure we'll find that there are other health units as well that are in the same position. And, you know, we can do what we can to try and get more money from the province. So, okay.
Yes, thank you, Jamie. Hold on to that thought. Any further questions from anyone at this time? No? Okay, moving on to 9.0. We do not have an in-camera session noted for today's meeting. Before we adjourn to the board, does anyone have any further business before we adjourn from the Finance and Property Committee for this session? Nope. Hearing none. Moving to 10.0, we hereby adjourn, and I turn the meeting over to someone.
I'll take it. That would be me. And thank you very much, Marianne. Did an excellent job. Really appreciate it. So we will call to order the Board of Health meeting. And the first order of business will be to elect a chairperson and vice chairperson of the board. So we've got two nominees for chairperson, Jamie McGarvey and Rick Champagne. And they've both allowed their names to stand from what I understand. And thank you for agreeing to put your names forward. Are there any further nominations at this time? And we'd be happy to take them. Okay, seeing none. Similar to the previous meeting that we had, I'd like to begin by asking each of the nominees in turn to introduce themselves and say a few words about why they would like to be chairperson. And I'll ask Jamie to begin and Rick to follow, please.
Thank you, Dr. Chirico. I enjoyed my tenure in the board last term, which was really good. It's interesting. It's a great learning experience. I am a big one for advocacy, and I think through my work with AMO and as president of the Association of Municipalities Ontario, certainly we can use that. I'm past president now. We can use that to garner as much public attention and attention with the different ministries that we are associated with, that to try, as we went through in the last section there, the government needs to step up more than what they are, and municipalities are suffering the consequences of, and public health is suffering the consequences of their lack of funding. So we need to move forward on that. I'm also on the District Social Services Board here for Parry Sound District, and I chair the Land Ambulance Committee as well, as well as being the mayor of the town of Parry Sound. So I hope to use whatever resources that I have to help our public health board move forward and to also strengthen public health across the province. Thanks.
Thank you, Jamie. Rick?
Thank you for the opportunity and thank you for the nomination. I've been part of the health unit for quite a few years. I stepped away for about 8 years, back on again. Public health has always been a part of my, it's always been a part of my heart. And since I've been involved before, I was also part of the negotiation committee when we took over from basically Parry Sound, joined North Bay. And it was tough at the beginning, but we were able to rake and work it through, and working with the ministers in order to get all the funding that we needed. And then I was also part of the committee when we had to go to 31 municipalities. I was chair at the time, to go every one of the municipalities to have them approve this new building that we worked on. And it was a tough go because Parry Sound just had a bad taste in their mouth because they just lost a new building in Gravenhurst. So the feeling wasn't a good taste at the time. And it was hard to work with the municipalities, but we were able to do it. And I think I had a big part to do with it. And also, like this building, I just went through it today for the first time. I was part of the getting it. I was never into the building before, so I looked at it today, and it was really nice to see. And the room that you all have to work on, and the strides you went through the last few years. And again, just like my counterpart just said, I was at the Roma this week too, and it's funny, the public health minister kind of talked over top of public health a little bit, just kind of said, well, the funding is still there as far as COVID goes, but didn't mention anything about the split. And talking to other municipalities about the 70-30 split that could happen, it used to be 25-75. They don't realize what's going on, and there's a fight coming on, and I'm willing to fight for what I believe in, which is public health. So thank you.
Thank you both very much. And does anybody have any questions that they want to ask either? We didn't do it last time, but if you do, we're more than happy to ask. And if there aren't any, then we'll pass it back to Sherry to get us moving on the voting.
Okay, I just launched the poll.
Hopefully everybody can see it.
Okay, we have 11 responses, so congratulations, Rick. You are the Board of Health Chair. Thank you, Jamie.
Well, thank you very much. We have a motion that we need to have a mover for the motion. Jamie, thank you. Lowry. Jamie's all straight.
Really, Jamie here.
And do we have a seconder?
I'll second that, Dr. Churko. Dave Wolf.
Oh, thank you very much, Dave. And I saw Jamie put your hand up. Thank you, too. So be it therefore resolved that Rick Champagne be elected chairperson of the Board of Health for the North Bay Parry Sound District Health Unit for the year 2023. All in favor? Seems everybody. Thank you. Thank you, Sherry. And I'll turn it over to Rick to proceed with the meeting.
You know how this goes?
Yep. Perfect.
Thank
well,
you,
thank you everybody for your support, and hope I do what I think I can do. Thank you. First of all, on the elections with 2.2, election for vice chairperson. Do we have any nominations for vice chair?
I'd like to nominate Sarah Inch.
We have Sarah Inch. Are you willing to stand?
And we have one nomination for Gary Gunther.
Okay.
I would like to nominate someone. I would like to nominate Jamie M.
This is going to be good. JM, JR, and JL. Right, so we have 3 nominations. I'll ask first if you're willing to stand. Sarah? No, not Sarah, sorry.
Yes.
Yes. JM, were you willing to stand?
Sure. Yep.
And who was the third?
And Gary Gunther.
Gary Dumper. Are you willing to stand?
Gunther.
Yeah, Gunther, yes.
I'm willing to stand, although if Jamie has an interest, I guess I would put my direction towards Jamie, actually.
I would also, this is Sarah, I would also put my direction towards Jamie, should he want to stand.
Okay. Jamie, are you willing to stand?
Yep, I'm willing to do that. Yeah.
I don't know what Jamie is talking about.
Yeah.
Thank you. I think this is
They're going to
Jamie,
start calling you by your last name, McGarvey.
Yeah.
Sorry.
Yeah.
McGarvey,
Let's do it.
are you willing to stand?
Yes. Yeah.
All right.
So no need for a poll?
No need for a poll.
No need for a poll.
Congratulations, Jamie.
Thank you. Thank you, Sarah and Gary. as well.
McGarvey.
Thank you.
All right. We have a motion. All in favor? Carried.
Yes.
I don't see anybody on the screen here, so I don't have the,
1 second.
just give me a second. We have a technical difficulty here.
Going through your email, you have the invitation. Here it is. So where is your initial email invitation? From Sherry.
I'm going to have Trevor come.
I apologize. My screen just went blank.
Need the, or actually, no, go in your calendar. There we go. And then we can join. Oh, try that again.
I did that. I did that. It was up and then disappeared.
This is the
Do you want to try and figure it out there? I'll just move aside and you can just keep going. Okay, we'll carry on while he figures it out. Approval of the agenda. We need a mover and a seconder.
I'll move acceptance. It's Gary.
Dave Wolf, I'll second.
Who's Dave Wolf, a second?
Yes.
Yes.
And first was moved by
Gary?
Gary.
Gary. Okay. Thanks, Gary. All in favor? Carried.
Yes.
I can't see it yet, but I assume everybody is in favor. Perfect. There you are. We're back. See me now? There we go. I apologize for that. Conflict of interest, any declaration at this time? If not, if you see something come up during the meeting, just let me know. Thank you. Approval of the previous minutes, 5.1, Board of Health minutes, September 28th, 2022. So I need a mover and a seconder.
It's Mary Ann, I'll move.
And I'll second. It's Gary.
All in favor? Thank you.
Yes.
One abstention.
One abstention? Okay, sorry. And I'll get this one right, Mr. Switzer.
Right, thanks.
Thank you. Motion moved. Date of the next meeting, 2023 meeting schedule.
Be February, I don't know the date.
So there's a motion for the whole schedule for the year?
All right.
Should be in your package.
Yeah, I'm just trying to pull it through here.
It's February 22nd. There's also April 26th, June 28th, September 27th, November 22nd, December 29th, and January 24th.
Oh, there it is. Okay.
And then,
Okay, like I believe Sarah gave us the dates here a second, but I'll go through them again. February 22nd, April 26th, June 28th, September 27th, September 27th, November 22nd, November 29th, and January 24. There is a motion for this here, right? Do you have a mover and a seconder, please? Okay.
Oh, to the agenda.
So that's Jamie R. So JR, moved by, and second by
Jamie M.
Jamie M. There you go, JR and JM. Thank you. All in favor? Carried. 7.0, appointment of standing committees for 2023. Now, is this where we, it's Finance and Property Committee, right?
The Finance and Property Committee and the Personnel Policy, Labor, Employee Relations Committee.
Okay. Do we have anybody to stand for this?
Pardon?
Is everybody standing for this? For the chair?
No, you just have to read the motion, just to say that those are the two.
Oh, sorry,
committee.
I apologize.
Oh, no problem.
Okay, we have a resolution here that the Board of Health of North Bay Parry Sound Health Unit approves the appointment of the following Board of Health Standing Committees for 2023. 1, Finance and Property Committee, comprised of all board members to deal with matters of finance, banking, insurance, property, and financial policies of the Board of Health. And number 2, the Personnel Policy, Labor, Employee Relation Committee, comprised of all board members to deal with matters related to the collective agreement, unions, and employment policies, non-union, and the personnel policies of the Board of Health. I need a mover and a seconder. I got David Wolf.
I'll second it.
Second by Jamie Larry.
Hey.
JL.
JL. Or J-Lo.
Oh, dear.
Not even close.
Everybody's getting a nickname.
Everybody's getting into it now. Okay. All in favor? That's carried. Next item is appointment of signing officers. It be resolved that the Board of Health of North Bay Parry Sound Health Unit approves the signing officers for the year of 2023 as follows. Board of Health Chairperson, Board of Health Vice Chairperson, Medical Officer of Health, Associate Medical Officer, Executive Director of Clinical Services, Executive Director of Community Services, Executive Director of Corporate Services and Privacy Officer, Executive Director of Finance, Executive Director of Human Resources, which is Dr. Cherico, Dr. Carol Zambalati, and Shannon Manta, Louise Gagne, Paul Maricotte, Mavicette, Isabel Churcher, and Jose Goulet. Need a mover and a seconder?
I'll move it.
Sarah. Second by Jamie M. GM. All in favor? Carried. Appointment of legal advisors for 2023. It be resolved that North Bay Health and Parry Sound District Health Unit approves the appointment of the following legal advisors for 2023. Corporate Legal Advisor, the Corporation of the City of North Bay, Lucenti Orlando and Ellis, Frank Williams and Associates, Enforcement Legal Advisors, Joseph Kennedy, the Corporation of the City of North Bay, Health and Protection and Promotion Act, HAPA, Legal Advisor, Joseph Kennedy, Middleborough and Stevens, Larmer and Jackson, Labor Relations Legal Advisor, Filion Wackley, and Thorump and Angeletti. Correct?
Yeah. Chair, I'd like to declare a conflict on this one because Lucenti, I'm related to Sandra Orlando.
Okay. Need a mover and a seconder. Moved by David Wolf. And second by Mary Ann. All in favor? Carried. So noted for Jamie Larry.
Lowry. J-Lo.
J-Lo. You like the name J-Lo? All right. Business arising. Do we have any?
No.
To resolve that the recommendations of the Finance and Property Committee that the Board of Health of North Bay Parry Sound District Health Unit approve the 2023 Board of Health Public Health Budget as presented, with a total share base of $17,160,000
Sorry,
I apologize.
are we skipping?
Dr. Cherico.
Well, go ahead if you want, and we can come back to me.
Okay.
Keep going.
We need a mover and a seconder. Moved by Mary Ann.
Second.
Second by Jamie Larry. J-Lo. All in favor? Carried. I apologize, Dr. Cherico. We'll go back to 11.0, report of the Medical Officer of Health.
No problem. Thank you. So the Board of Health meetings, we always put in Medical Officer of Health, Executive Officer report. And the report's really meant to provide the board members with more detailed account of the programs and services being provided by staff at all levels of the organization, and any updates that we have and from previous reports. So, you know, feedback from previous boards have stated that it's been very helpful to have this information, to give them an overview and very much a detailed view. And I hope you find them to be particularly useful. And if you have suggestions on how we can improve or what information you'd like to see or trends, or we will certainly try to provide that. The other thing we like to do is, and to your point, Morris, about not just numbers, but people, we try to provide, when we can, stories about clients and how we've interacted with them and what some of the results have been. So obviously, because of the pandemic, we haven't been able to provide as many sort of detailed MOH reports, but we certainly want to get back to that as we move back into a little bit of normalcy, whatever that's going to look like. So happy to answer any questions, because I'm not going to obviously go through the report. You've all had a chance to look at it, but if there's any particular questions that you'd like me to deal with, and if I don't have the answers, I'd be more than happy to get back to you about them. Not all of the executive team, which might have very specific details on their programs and portfolios, but be happy to entertain what I can answer. Yeah,
Morris, through the chair, Doctor. Again, I love the numbers of people. You know, the number of people who were served here. That means that helps justify any request we make for dollars. You know, the number of people. I'd love to see what the total number of people in this in our catchment area that in a year received some kind of service. You know, it's got to be more than our population. It's got to be, you know.
It may be difficult to actually get that.
Might be hard.
Our area covers about 17,000
square kilometers.
Yeah, and it's about 129,000. Not what the impact is saying, more census.
Yeah.
And those two are different for sure.
But I like the report. Thanks very much. And a couple of questions. I mentioned about communications. I was glad to hear you say, you know, that you're going to get back to doing some things. And I understand that anonymity is often an issue when trying to tell stories. The local media are, you know, might be interested in working with your communications team to provide, you know, human interest kind of stories about people who have benefited from individual programs. Again, respecting anonymity.
Sure.
I just wanted some elaboration, not too much, but I wasn't sure about quality issue reports, QARs. Those are internal issues?
Yes.
Yeah, okay.
Yeah, those are, and thanks for bringing that up. And again, to be fully transparent, and what obviously we want to learn from any issues that have occurred. And these quality reports will detail anywhere from an issue that has absolutely no effect on anybody, but we do detail them, and all the way to those that may have been impacted and or all the way up to anything that is very severe will be reported to the board, and there'll be an explanation as to what's been done about it, so we're held accountable to you, and we make this very much accessible to the board.
Okay.
For that.
One other, there are a couple of other things. One, the adult dental clinic, and again, this is, as we discussed earlier, this is a role that you wouldn't think that health units in many ways had to play, but we're doing it, and it's important. But I noticed, I believe it said there was a 2-year waiting list.
Yeah, we have, it's been a significant problem. The municipalities have stepped up when we've asked them to help with some funding for this. We have dentists on staff, total of 2.5. However, with the workload that we have in dentistry, we have had to go to a system, especially with adult dental, that we're just doing emergencies essentially. And because a 2-year waiting list is meaningless when somebody's in pain. So we follow up with patients to find out, you know, what the issue is and how quickly, but, you know, we need help from all the dentists, and that is something that is so important to be able to get. But we have worked really hard to service the needs, and it's certainly not ideal. And Dr. Zimblati, would you like to?
I actually just wanted to go back to the question of, telling stories about people we serve, and rather than just the numbers. And I totally agree that it's important to tell public health stories, though it's not always related about individuals that we serve, because so much of what we do is upstream, done at a population level. So if we are just, telling information about how many people our dental operatories served, well, that's not or how many we saw within our clinics. It doesn't really get the full picture or convey what public health focus is. And I think it's important to tell those other stories as well of what we are doing upstream.
Mm-hmm. Thanks. I'd be glad to work with I have some communication experience. I'd be glad to work with your communication professionals to share ideas anytime.
Well, I think certainly with that, we certainly appreciate your perspective on things, and that's very, very important. And again, more than happy to talk to me about some ideas that you might have.
I don't want to interfere at the operational level, I understand. You mentioned, going back to the dental clinics, and you mentioned in the report there are partnering dental providers, that help with the workload.
Yes.
There's a young woman in town of my acquaintance who works for a dental office, who on her own time has launched a equity in healthcare initiative, and she is working with members of the local dental association to encourage them to do the kind of work that I think the public health unit is doing. Would there be any value in me connecting her with someone here?
We're always looking for help, absolutely. Yeah. And it's going to take everybody to address this issue, and it's a significant healthcare issue. I mean, there's no healthcare without dental care as well. We all know that. It's very important to improving that kind of care. So yes.
Yeah,
we certainly welcome anybody that's going to help us out.
It's Indigenous populations that really end people, impoverished people who really have challenges. I know that if you're an Indigenous person and you're relying on the non-insured benefits program, you can wait for months for what is called prior approval to have something that needs urgent care done, and they may be some of your clients here because they can't. I'm fortunate because I have the privilege of not having to rely on NIHB to do my work. If I have something like I did last year, a cracked molar, I can get it done and pay for it as the dentist wants. But and thank you. And my last question is, what are polyfluoroalkyl substances and their connection with CFB North Bay?
Yeah, what you're talking about is PFAS, and it's a chemical that was used many years ago, and that it's well known. We've been dealing with it for a number of years. That up at the air base, they were using it for firefighting foam, and what it ended up happening is that this chemical, and you may be reading more and more about it and hearing more about it, not only here, but it's worldwide. And it's a chemical that has, thousands of substances within that group. Mm-hmm. And within that firefighting foam, it got into the ground at the air base, and it leached into Lees Creek and down into our drinking water system. And we've been dealing with it for a number of years, working with the city, working with Department of National Defense, monitoring, working with the Ministry of Environment. So that's an issue that is ongoing, and it's certainly a concern.
Okay, thanks. Thank you.
Okay. Thank you, Morris, and thank you for willing to help us, and thank you for your comments. Sarah?
Okay, so I am wondering a couple things. So I don't see anything regarding fetal alcohol syndrome anywhere here. Do we have anything in place to help prevent that?
We do address that as part of the Healthy Families Program.
Okay, and the other thing
It just
is
wasn't reported on
this document.
On this, yeah.
Yeah. Okay, because that could be something that it's very important. It can be prevented, right? It's very upstream.
Yeah, and that's where our health promoters also come in with that kind of preventive strategy.
Because, unplanned pregnancy.
Very important.
Yeah. And then I'm looking at, it seems like there's lots of stuff for needle exchanges and things, but what about other drug problems? Because there's a lot of alcoholism. There's people who use methamphetamine, crack cocaine. There are other drugs in our community. And how are we dealing with that? Is there anything in place for those?
Yes. Let me just say that the substance use problem is certainly very complex. It involves, like you say, Sarah, a lot of different drugs, substances, smoking, and the health unit is involved at many different levels, depending on what substance that you're looking at. So in broad terms, we have our, healthy families, healthy schools, healthy living. We also have, we have programs that look more upstream. So we also have the needle exchange, which is very downstream. So it covers the whole spectrum. But more upstream is working with collaboratively with other community partners to address those complex problems. Just take drug use. It is a problem that involves so many different sectors in our society to help address it. And it's not going to be something that's going to be solved certainly overnight. It's going to take the efforts of everyone to address that. And there are many different aspects to it. So we can't do it alone, but we try to certainly address what we can, what's within our capabilities, and to work with community partners to look for solutions. But I can assure you that we know that one of the statistics is that 70% of health solutions to poor health lies outside of the healthcare system, and the social determinants of health are what we need to address alongside not just the interventions that occur in an individual level. And to Dr. Zimbalati's point, individual issues are important for sure, but if you don't do anything about the more population-based needs and look at what's causing it in the first place and how to address that, you're never going to end what we call, or what's been termed hallway medicine, in that it'll be a revolving door in the emergency department until we can get that more upstream approach. And that's going to take everybody in all different sectors and social services, mental health, all of those things. So I hope that kind of answers
Yep.
your question.
I also had a question about the community partners who are receiving the health equity training. Could I have some clarification around that, what that is?
I would have to get back to you on that specifically.
It said 17 community partners have received health equity training.
Yeah.
Around safe spaces and LGBTQS plus stuff.
Yeah, I'm not sure what you're asking as far as which ones. But we do reach out to community partners for health equity, absolutely.
Is there a list anywhere of those community partners, though, available?
I'm not sure if we can, or if they would want us to be passing that information out. We certainly know who is, but I can't say for sure right now that I could give it to you as to who they are.
Maybe we can do is get Dr. Cherico to get back to you on this item and bring it up for the next meeting. Would that be sufficient, or have you got the list here?
Well, Shannon Mantha, our Executive Director of Clinical Services, has raised her hand, so perhaps she can.
Okay. Oh, there you go.
Okay.
Hi.
I didn't see your hand up.
Yeah.
Go ahead, Shannon.
Yeah, so can you hear me?
Yep.
Yeah, okay, perfect. So I can't speak to the the details around which exact community organizations are partners, but as part of our work related to health equity, we do a lot of, so this speaks a little bit to Dr. Zimbalati's comments around more upstream work. So we focus often with skill building and providing education with community groups. One of the areas that we look at is safe and positive spaces. So we work with community partners like Out Loud North Bay, Rainbow Health, other important community partners in that forum we provide training or skill building opportunities. So sometimes we do it, or other times we actually fund the training. Sometimes it's used for group training. Sometimes it might be used to upskill an individual. I'm just trying to think of an example to give you, Sarah, that's tangible. So providing funding to the Multicultural Center to have their one of their staff receive training in safe and positive spaces, so that space in our community can be a more welcoming environment for specific populations. So I can get more details for you, but that's just maybe the Coles notes of that.
Okay. Yeah.
I think if I might, Shannon, I think the North Bay Indigenous Friendship Center has had people come to speak to groups about dietary, good healthy eating, things like that. I think, Shannon, is that the sort of thing?
Yeah, so we do capacity building and skill building work in a number of settings. So it might be on any topic like nutrition. It could be on physical activity, whatever, our mandated topics to promote health. And one of the ways, instead of providing one-by-one education, we try to target groups and have them teach them the skills, so then they can go out. It's like a train the trainer sort of model, I guess. It just builds capacity in our community.
Is that sufficient for Sarah? And how she getting more information for you?
Yeah, I just, health equity, as I understand it, is creating equal access, not giving people equal things, I guess. And I was just curious about which community partners had successfully applied for the use of the health units available health equity training funds.
Yeah,
and I didn't realize it was a confidential list. I guess if it is a confidential list, that's fine. Any rate?
No, it's not a confidential list at all. So I can get you that information. Typically, we would work with from the health equity approach. It's not about equal access, like you said. It's about leveling the playing field. So we would work with community agencies that service marginalized populations. That's our primary focus. So, Out Loud would be a great example, Out Loud North Bay, and then the North Bay Indigenous and the Parry Sound Indigenous Friendship Centers are two other examples of community agencies that provide services for marginalized groups.
No, the great question, Sarah. I guess just before I go to Jamie, again, there's the great question is just get the proper information out. Maybe we have something for the next meeting for Sarah again, just to make sure we get the proper information out.
Yeah, because health equity, I'm thinking that people have to become aware of the fact that there is this training available and there are funds available for it. And I hadn't heard anything about it, and that's the first time I'm learning about it. And I'm part of the public, so I just think that is maybe something that could be promoted more.
No, for sure. And we get
Sure.
the proper information, make sure you get the right answers for the next meeting. Is that sufficient?
Okay.
Okay, and the next, thank you again for the comments. And we have somebody else have their hand up. There we go. Jamie M. McGarvey.
Thank you. So the question's for Shannon. Do you work with the drop in Perry Sound?
So I'm going to toss that to my colleague Louise because I think we do, but it's from a youth school-based perspective. So I think we do, Jamie, but I don't want to speak out of turn.
Okay.
Hi, Jamie. Yes, we do work with the drop in Perry Sound, and quite closely, particularly with our Healthy Schools program, and actually working with them at the moment to identify some youth ambassadors for an upcoming presentation that we're doing.
Very good. I just wanted to make sure of that. They're really trying their best to put the programming in place. So thank you.
Thank you, Louise. Thank you, James. Any other questions for Dr. Cherico? Again, great questions and great answers, and hopefully we get all the information we need for the next meeting for Sarah. Everything is important that we do at Public Health, so let's make sure we get the right information so we get it out there. Thank you.
Do we need a mover for that, or is that just for information?
No, it's just for information. All right, so we'll move on to 13.0, correspondence. What's the protocol for correspondence?
Oh, it's just for your information, and if anybody has any questions.
Okay.
And for some of it, I would certainly have to get back to you on some of it, because we get a lot of correspondence.
And all of the correspondence that's listed in the attachment in the agenda package can be found in the Board of Health Teams group under correspondence.
Under correspondence?
Yeah.
Okay.
So everything listed there, you can see the correspondence that came in the Teams group.
Okay.
Okay.
Any questions on the correspondence? I see none. So we'll carry on to 14.0, new business. Board of Health bylaws. Whereas the Board of Health receives a review written notice on January 25th, 2023 of the proposed revision of the Board of Health bylaws to regulate to proceedings of the Board of Health as shown in the track change to the above noted documents. Now therefore it is resolved that the Board of Health approves the revision of the Board of Health bylaws to regulate in proceedings of the Board of Health for the North Bay Perry Sound District Health Unit. I need a mover and a seconder. Jamie Lowe. Lowry. I promise by the next meeting I'll have everybody's name perfect. The one I got for sure is Mr. Switzer, and everybody else will follow line. I need a seconder. Karen? Karen Cook.
That's easy.
No, I'm going to call you Casey. Okay. So would you have any discussion on this motion? Seeing none. All in favor? Carried. Next item is 14.2, corporate sponsorship and donations 2022. There is therefore to be resolved that the Board of Health of the North Bay Perry Sound District Health Unit authorizes.
Not yet.
Not yet.
So for 14.2, it's just a note that the health unit did not initiate any corporate sponsorship in 2022.
Okay.
And 14.3, the health unit did not initiate any requests for proposal or initiate any tenders in 2022.
Okay. 14.4
is your motion for the Association of Local Public Health Agencies Winter Symposium.
Okay, there you go. Thank you. Therefore, to be resolved that the Board of Health for the North Bay Parry Sound District Health Unit authorizes the Board of Health members to attend the Association of Local Public Health Agencies, ALPHA, 2023 Winter Symposium to be a virtual on Friday, February 24th, 23, and furthermore that resolve that expenses related to the attendance of the ALPHA 2023 Winter Symposium be paid in accordance with the Board of Health Remuneration Policy B-004. Need a mover and a seconder. Moved by Mary Ann, second by Jamie R. All in favor? Any discussions on a motion? See none. 14.5, Board of Health Training Opportunities, how to make your practice that positive. Who speaks about
I'm not sure.
Can I comment?
Sure, go ahead, Sarah.
Okay, so it does say that the training is being offered in follow-up to the 2021 internal survey about weight bias. So I guess if it's felt it's needed, it's needed. And this seems like this is something that's new.
So this was circulated to all staff, and it was requested that it be, the training opportunity be shared with Board of Health members if they would like to participate in. So this is notification of the training opportunity, and if anybody is interested, they can contact me, and I will get you the actual email and link to register.
Thank you.
Okay.
Anybody else have any questions on this item? Okay. 14.6, Quality Issue Report 2022, report to the board.
Again, as we mentioned before, that if there are any, it's available to the board if there's any questions.
Okay. Do we have a in-camera item? No, we don't. And we have an adjournment. And before we have the adjournment, I just want to thank everybody for coming out and putting your time in. And I do promise that I will have all your names correct. And again, thank you again for your time, for coming out and spending, and all your comments are well valued. And thank you, Dr. Cherico, and your staff for everything you do for us.
Yeah, and again, from our from executive team and all other staff, thank you all for representing your municipalities and for representing all of us. I mean, it's going to be a very important year, and the engagement that you've shown tonight is really, really encouraging. And so, thank you. And my door is always open. You need to speak to me. Anything I can do to help, let me know.
And I apologize again for the technical difficulties tonight, and even from my own point that it's kind of thrown into the fire really quick here, and I had to paddle. So we have an adjournment. Is there a motion for adjournment here? I don't see one here. So, okay. So again, thank you very much, and good night.
Thank you.
Thank you.
Good night, all.
Thanks for dinner.
Good night, everybody.
Bye.
Good night. Thank you.
Good night.
I think that we do have the media that may be asking some questions.
That is correct. So we have received 5 media inquiries today. So I will go through them just one by one in order. So our first is from Stu from Bay Today. Is vaccine hesitancy or outright vaccine refusal higher than ever? As a medical professional, do you reach the point that you stop trying to convince those who are unsure about vaccines and shift your focus on those who are?
Thanks, Stu, for the question. To be honest, as we host vaccine clinics, the individuals coming to the clinic are the ones who are voluntarily coming forward for doses. So we aren't really having these conversations at our clinics. Our call center and many other online or telephone resources remain available for those with questions about vaccination. Our call center has seen a decrease in calls relating to vaccine hesitancy. And at this point in the pandemic, I feel that most people have made up their mind about the vaccine. Most are in favor, but some are opposed. And we continue to make ourselves available to those who have a genuine interest in learning more about vaccines.
Yeah, and I'd just like to add that we don't judge, and that if somebody is hesitant, it means that they really are trying to get more information, and whatever they decide, I mean, we're available to help them and to provide them with accurate information. I think that that's one of the biggest issues is that there's a lot of misinformation out there about vaccines, and we're more than happy to provide what we believe is unbiased information that is from credible sources, and it's really up to the individual to then decide, the ones that are hesitant about vaccines. And what we can certainly say with that is it's solid that in scientific information that the vaccines have been of tremendous value. Yes, there's certainly complications that can arise with any drug, vaccine, whatever you ingest or put into your body, certainly. But they have been a tremendous benefit, even certainly prior to COVID-19. So more than happy to help answer anybody's question.
Thank you, Dr. Sambalati and Dr. Chirko. The second question is also from Stu. In long-term care settings, masks are mandatory and COVID-19 testing continues for those seeking access to the building and their loved ones. In your professional opinion, will these practices ever come to an end?
Okay, thanks again, Stu, for that question. We realize the benefits of infection prevention and control measures must need to be balanced against the needs to minimize barriers for residents of long-term care homes and for these residents to be able to see their family members on a regular basis and loved ones is of utmost importance. I do believe that the balance will gradually shift towards lessening measures, but I can't say exactly when or what those changes will be. We certainly have learned a lot while managing the pandemic and outbreaks in long-term care homes, however. And I believe that some measures for visitors, like symptom self-assessment prior to visiting long-term care homes, should be in place indefinitely.
Thank you, Dr. Sambalati. And our third question from Stu. Will COVID-19 rapid testing ever approach the efficacy of PCR testing?
Yeah, it's an interesting question because really the two different tests have different strengths. So I do imagine that rapid antigen testing will improve over time, but they won't be able to ever match the sensitivity of PCR testing because with PCR testing, the test amplifies the target as it's testing for it, which antigen tests aren't able to do. However, in reality, do we need that level of sensitivity? And, rapid antigen tests, however, are much easier to use because they don't require specialized equipment. So they're very useful in many settings. Because of the differences in the strengths and weaknesses of these different tests, both will likely continue to be used in different settings and for different purposes.
Thank you. Our next question is from Jennifer from the Nugget. How many full-time positions have been eliminated and what are the projected cost savings?
Yes, thanks for that question, Jennifer. The answer to that is a certain number were eliminated and some were created to balance the needs of the organization. And so we're left with a 1.23 full-time equivalent reduction, which is approximately $170,500 at this point.
Thank you. And our last question is also from Jennifer. Regarding the dental situation, why is the wait list so long? Is there reasoning? Was this gradual or all of a sudden? Are you seeing clients going to emerge because of the wait times are so long?
Yeah, thank you for that. because it certainly does highlight the need. To answer your question, we've always had a long waiting list, but because of COVID, and that has certainly increased it. It's just basically that, you know, there's a huge demand in the public for these services that essentially people can't afford to get care at regular dentists. They just don't have that kind of money. And so we're inundated with demand, and we don't have the capacity. We only have, as I say, 2.5 dentists on staff, and 2 of those are dealing with having to certainly deal with the children as well as the adult dental, certainly working with the seniors. So those 3 programs have to be covered, and so that's why we just don't have the capacity. And the solution certainly has to be dealt with all stakeholders to find a solution to that.
Thank you, Dr. Shirko. That completes our media questions for today.
Thank you.